per instructions, the speakers are allowed to take their masks off when they speak. So I'm following all the rules here, but hoping you all can hear me, which is why I'm taking this off. Welcome, everyone. Thank you so much for being here for this incredibly important discussion. And, you know, we're here for the very clear reason that access to affordable and quality early learning opportunities is a matter of basic infrastructure. Having a safe place for children to learn and develop gives parents the flexibility they need to work and support their families. But beyond supporting families and our economy, it also invests in our future by preparing kids for success in school and beyond, decades to come. By the age of 5, 90% of a child's brain has developed, making the progression from birth to kindergarten the most significant brain development period in their lives. We know that access to quality early learning opportunities during this time significantly improves literacy, language, and math skills. Children who reach kindergarten academically ready are more likely to succeed in later schooling, and that sets them up for success throughout their lives. That's the stuff we know. But there was too much that we didn't know, which is why we're here discussing the study that we worked with Crane on. We funded this study because for all the research on the importance of early childhood education, we actually have too little knowledge of what choices parents are making and experiences children are having during this critical time before they're 5. There are nearly 70,000 households with children under 5 in our city, and we have to understand where they are, what barriers exist for their parents, and how to reach them if we're going to have a shot at making high-quality early learning accessible to all. Now, what we didn't anticipate when we first formulated the idea and need for this study, and when Crane embarked on this, was a global pandemic, which really put this critical industry into crisis and put parents into crisis. Not just when the shutdown occurred, but in the year that has followed. Therefore, we couldn't be having this conversation at a more important time. I'm so grateful for the partnership and work of Dr. Justice and Dr. Ansari and their colleagues at the Crane Center, not only to help answer these key questions, but to say, after the world shut down, we can do this anyway. We can figure out a way to do this work, understand what choices families are making on the ground. We can do it safely, and it's more important than ever. Fun fact, a meeting about this study where we were kind of getting the final strings tied and details figured out was my very last meeting in March of last year before everything shut down. So I really do want to underscore my gratitude to the Crane Center for figuring out how to get us there. I want to acknowledge and thank Future Ready Columbus. Jane Leach is here in the audience for being a partner along the way to make this study possible. So now, to learn more about, to tell us more about what we've learned, I'd like to introduce Dr. Ansari.
Good morning, everybody. Can everyone hear me? Awesome. So my name is Ari Ansari. I'm an assistant professor here at OSU, and really excited to have this opportunity to talk to you all about some of the work we did earlier in January and February of this past year. And so we did a landscape study in Columbus, in Franklin County, in response to what Councilmember Brown outlined for us here today. I want to acknowledge that this is a larger team effort, each of whom played a critical role to pushing this project forward. But before I begin talking about what it is that we did, I want to sort of expand on what Councilmember Brown sort of outlined for us, which is in recognition of a problem, which is that many children are struggling as they enter kindergarten for the very first time. We've seen estimates from a variety of states and across the nation that roughly 2 out of every 5 kindergartners is at risk for kindergarten difficulty in areas of literacy, social skills, math, and self-regulation. So that's about 40% of our children in this nation. And this is truly problematic because once children fall behind as early as age 5, they oftentimes continue to stay behind throughout their educational careers. And it's not just that all children are equally at risk, we've seen that across the income distribution, our most disadvantaged children in this country at kindergarten entry are up to 2 full years behind their most advantaged counterparts. A pretty massive opportunity gap. And that, as Councilmember Brown alluded to, is really the impetus or the foundation for investing in early childhood education. We've seen decades of evidence that children who attend ECE enter kindergarten demonstrating stronger academic skills, cognitive skills, working memory, inhibitory control. And under optimal conditions, they also demonstrate stronger social behavioral skills relative to children who do not have the luxury of attending an early childhood program in the birth to 5 space. So a host of benefits for these young kids. And it's not just that all children benefit equally. We've seen that children who come from more disadvantaged communities stand to benefit the most from program enrollment, with some estimates suggesting that the most disadvantaged children stand to benefit by about 50% more than their more advantaged counterparts, suggesting that investing in early childhood education is a key vehicle for mitigating the opportunity gap that exists in the United States. So it's with this in mind that we were really interested in understanding what's happening in Franklin County. If children stand to benefit from program enrollment, where are children in our community spending their time? And what are they doing in these programs and in these settings? And just as importantly, what are the barriers that families are experiencing to enrolling their children in early childhood education programs? So those were our 2 broader aims as we sought to do this project. So we took a broad sampling approach, bought some data from a marketing group, and identified roughly 520,000 households in Franklin County, of whom roughly 70,000 had a children under the age of 5. And what we wanted to ensure that our sample represented was it was representative of Franklin County as a whole. So we used census data to generate or to sample from 45 different zip codes in our community so that our study sample is representative of Franklin County as a whole. And this right here is a map of the 1,500 children and families that we sampled across our community. But we were also interested in 3 communities in particular, Linden, Hilltop, and Southside, for whom the district or the county has made a lot of investments in the early childhood education infrastructure. So we oversampled about 1,000 kids from Linden, Hilltop, and Southside. So as I'm going to present the results for you today, I'm going to be talking about a Franklin County sample, and then I'm going to be talking about a 3-community sample, which corresponds to Linden, Hilltop, and Southside. So with that in mind, let's talk about what it is that we found. I'm going to be starting out with the proportion of children who are spending time in an out-of-home care arrangement, be it informal, be it a family child care provider, or be it a formal early childhood education program. How much time is spent outside of the home? So here's what we found. We found that in Franklin County as a whole, between the hours of 9 and 5, Monday through Friday, roughly half of children are spending time in a setting outside of the home environment with a caregiver. In the evenings and on the weekends, these estimates drop, not surprisingly, with 5 to 10% of children spending time outside of the home. Franklin County as a whole. Now let's drill down and look at Linden, Hilltop, and Southside. What we find is that there are some differences here. Slightly lower utilization on weekdays in the mornings, and slightly higher utilization of out-of-home care arrangements during the evenings and weekends, with estimates corresponding to roughly 10 to 15 percentage points, which suggests that the needs of families in these 3 communities is somewhat different from families in Franklin County as a whole. When we break these estimates apart across key demographic populations, we don't really see any racial ethnic differences. So these estimates are roughly comparable for Hispanic, Black, and white families. But we do see some differences across the education gradient. We find that non-college educated families have a slightly lower utilization rate of out-of-home care relative to college educated families, with about a 10 percentage point gap. So that's out-of-home care. Now let's drill down a little bit further and talk about among those children who are being cared for outside of the home, what proportion are in a more formal daycare or an early childhood education setting? So in Franklin County, among those children who are spending time or being cared for outside of the home, what we find is that roughly 85% of children are in a more formal early childhood education setting, Monday through Friday, 9 to 5 p.m. Evenings and on weekends, we see about a fifth to a quarter of children are enrolled in ECE. Larger disparities, though, exist in Linden, Hilltop, and Southside. We see that during the weekdays, estimates for early child education participation are below 80%. And on weekends, there's a higher utilization of early childhood education, which again emphasizes that the needs of families in Linden, Hilltop, and Southside are different from Franklin County as a whole, and we need to be thinking about the individual needs or the unique needs of families within Franklin County. Again, very few differences across different subgroups, except to say that among families who had children being cared for outside of the home, Hispanic families were more likely to rely on other family child care providers at a higher rate than white and black families, with about a 10 to 15 percentage point difference. So this is where children are spending their time. Now I want to show you all what children are actually doing to highlight why these differences in utilization matter. Because children have very distinct experiences when they're being cared for in a more formal early learning center or early childhood education program, and for those who are being cared for in their home setting. So I'm going to present results to you all in a graph format. X-axis corresponds to activities that parents suggested that their children engaged with. Y-axis corresponds to the percent of parents who said that their children did these things. And I'm going to present estimates for you all in this bluish color for children who are cared for at home, and in this reddish or dark bluish color for children who are in an early childhood education program. So what we see is that with respect to who children are engaging with, there are fundamental differences. Children who are cared for at home are far more likely to be playing alone or with an adult relative to children in an early childhood education setting. Or on the flip side, children in an early childhood education setting are more than twice as likely to be playing with other children. So who children are engaging with is very different across these two settings. Now, in terms of what they're actually doing, children who are being cared for at the home are far more likely to be watching television or engaging with iPads or playing with iPads or phones than children in ECE programs. Whereas on the flip side, children in early childhood settings or early childhood education programs, they are 3 to 4 times more likely to be engaging in cognitively enriching and academically stimulating activities, such as playing with reading books, working on numbers, arts and crafts, relative to children who are being cared for in the home environment. So very distinct experiences for children being cared for at home and children in these more formal early learning programs. So that's what children are doing. Now let's talk about what barriers families are experiencing in our community. The most common barrier that we see in our community is access to high-quality programming. 60%, or roughly 60% of families suggested that they had a very difficult time finding good quality care for their children. But again, there's a disproportionate impact on families in Linden, Hilltop, and Southside, where we find that 70% of families in those communities have a difficult time finding good quality care. Putting aside quality, the next barrier that families experienced was with respect to affordability, whether programs accepted subsidies, the hours programs operated, and the convenience, where are these programs located? But again, there are some important differences that are worth noting here. When looking at the barriers parents reported, we see some stark differences for Black, Hispanic, and white families. Hispanic families, their most commonly cited barrier is they had concerns about their children picking up bad habits from others in the program. Whereas Black families were most concerned about the convenience or the location of the program, it being too far, and whether the program operated during non-traditional hours. So what different families are experiencing in terms of barriers are also very different. So when we take all that together, there's 3 take-home messages, I would say. The first of which is that enrollment in early childhood education programs in Franklin County, and in particular in Linden, Hilltop, and Southside, is lagging behind national averages by about 10 percentage points. And this is something we really need to think about carefully in terms of our next steps. These lower rates may reflect the fact that families are experiencing, or they're experiencing a lot of barriers from their perspective with respect to finding high quality care. So those lower utilization rates in our community is something we need to think about. The second point is that there are, of course, quality programs in our community. That goes without question. But we really need to be thinking about access and knowledge. 60 to 70% of families in our sample said that they relied on their friends and family to find their program that their child was enrolled in. Less than 1% said that they utilized agencies and institutions that are meant to help connect families with ECE programs. Something we need to be thinking about. And the third and final take-home message has to do with these differences in children's experiences. Children in out-of-home care have very distinct and fundamentally different experiences than children who are being cared for in the home environment. And this is of note because those experiences, those academically enriching, cognitively stimulating activities, are the types of activities that drive children's learning, that prepare children for kindergarten and set the stage for their long-term school success. So I'll leave it at that, and we can transition to the panel discussion.
Thank you so much. Thank you, Dr. Ansari. That you clearly have a skill at distilling a lot of data, and the report is very long, and this was a great way to talk us through some of those key findings. So thank you for that. And you know, as we're going to move on to this panel discussion, and I just want to say I'm really sitting with those take-home messages as very important when we think about the quality of life for our residents here in our city and our county, when we think about the experiences that children are having here in our city and our county, and when we think about the long term for our city and county, right? This is not just, I happen to have 3 kids under 6. This is not just my problem, right? Or anyone else in here who has kids pre-kindergarten. This is everyone's problem. If we don't get serious about leveling the playing field for every family, how can we expect to remain competitive as a region? And along the way, how can we expect to do right by families? So thank you very much, Dr. Ansari. We are going to get into our panel now. Dr. Ansari will be sit on our panel. Annalise Johnson, principal of the A. Sophie Rogers School for Early Learning. Jennifer Cheeks, who is a Franklin County parent and early Head Start prenatal educator. And Kayshawn Jennings, who is a Franklin County parent. So thank you all for being here. Dr. Ansari, I'm going to start with you. In your presentation, you noted that Columbus is behind the national average. And can you unpack sort of additionally what that means for us in terms of not just what I just laid out in terms of workforce and parenting, but you know, what's behind those numbers? How hard is it to close that gap? Essentially, like, do we have any time to waste?
That's a fantastic question. I think the pandemic has sort of further exacerbated some of these disparities. And no, I don't think we have time to waste. I think this is an issue we need to grapple with very quickly because we know that these experiences set the stage for kindergarten success. Then what this means is that more children than necessary are entering kindergarten, potentially struggling in literacy, math, social behavioral skills than is needed. So I think we really need to be thinking about pushing on access and the transmission of knowledge with respect to getting families into these programs or giving them opportunities that meet their needs. And so I think there's a lot of room for improvement from our end in that respect.
Great. Ms. Cheeks or Ms. Jennings, or both of you, can you share a little bit with us about your own experience in accessing childcare? Because it's clear from the research that is a big piece of this puzzle, is helping families have that easier access.
I'll go first. My response to this question was, I'm a Cleveland native. I'm a mother of 5. When I moved to Columbus, I wasn't even sure where to go, what to do, not even like my way around. But I relied on my community. And through my connection with the community, I was linked with the Wyland Park Civic Association. And they introduced me to Susan Colbert, who worked for OSU Extension. I searched for months on my own. I missed several job opportunities, and she was able to help me find individualized care for all of my children.
That's really powerful. Thank you for sharing that. Ms. Jennings?
Well, I'm also an educator as well, so, I worked in the field for quite some time, so it was kind of easier for me to find childcare because I've been in the field for so long. So I just make sure where I worked at, my children were there. If I feel comfortable, then my children would come there as well.
Mm-hmm. That's great. That's great. Thank you so much. Dr. Ansari, several of the study's findings jumped out to me, but I'm curious to know, were there any other, besides your 3 take-home messages, sort of interesting facts that really inform the way that we need to think about variable approaches, given the difference between the 3 neighborhoods you drilled down to and the county at large? Equity has to be baked into any solutions.
Yeah, absolutely. I think that what resonated most with the group was the potential lack of equity that exists in our community, the potential lack of programs that are convenient and meet the needs of families. And so what this really suggests, at least to us, is we need to be thinking outside of the box and providing families with programs that meet their needs. So like if you go onto the website for Franklin County and look for childcare that provides evening care, provides weekend care, that you're looking for like a high quality programming, what you'll see is it'll dwindle down from about 1,000 providers to just like 15 to 20 providers, and that might not be in your vicinity or driving distance. And so this is something we really need to be thinking about more carefully in the coming months and coming years.
Mm-hmm, absolutely. And when you get down to so few options, not only may it not be convenient for the family, but also we know the childcare industry right now is having a hard time keeping up with the slots they need to provide to the community. So can you even find a spot once you do find a place that you can fit into that sort of home work hustle that everyone experiences? Something else that jumped out to me was the challenge that non-English speaking parents face when enrolling their children. In our county, about 1 in 10 people is born outside the country and has come here as an immigrant or a refugee. And that presents a lot of challenges in navigating, but even something as simple as paperwork. The language barrier can make that a real hurdle. So it's really important to be able to consider all of these factors: timing, that families need care, language that's spoken at home, and everything in between. Principal Johnson, and also our parents on the panel, any of you can speak to this one, but I'll start with Principal Johnson. We learned from the interviews that some parents are motivated sort of to keep their children out of early childhood education because they feel their little ones are maybe too young for school. School sounds to a lot of parents like 6, 7-year-old thing. So what do you wish more parents knew about what happens in formal early learning environments? And do you have any stories for us on how you've helped families make that leap?
I'm sure, yeah. I mean, we all know a switch doesn't just flip, that all of a sudden you start learning, when you go to college or when you go to high school, or that even in utero, things are happening that have profound impacts on children. So we emphasize with families the social emotional skills, what we call the soft skills, that are so critical during that transition. A lot of that is the conflict negotiation, the problem solving, the language and literacy that comes through that, that leads to those executive functioning skills that when kids go to school and kindergarten teachers say, they can't even line up, or I'm spending so much time just trying to get them to know how to use the toilet. Those are the executive functioning skills that then our elementary schoolers need to traverse down to the lunchroom and back, that my high schooler needs to get her homework done and go to field hockey practice. Those start building. They don't just all of a sudden turn a switch. So the foundational skills, their social emotional development, but also the language and literacy. So, that is also a foundation to everything math, to everything science, to every other subject that comes along. And you saw the disparities in the language that children hear at home versus at school. So, as you leave, you'll notice we're loud. As you walk out, we are loud. The children are talking, they're engaged, they're problem solving. They encounter a million different solutions and experiences that, as somebody who had 2 children too, I just can't do at home. I'll never be another 4-year-old girl. I'm never going to have that kind of negotiation about who's going to play the mommy or who's going to be the baby. And those are the things that really set children in the success.
Yeah, I mean, when my kids and I have a conflict at home, I just say, who's in charge?
Right.
Right? So that's not really building their social emotional learning.
Absolutely.
And, if my 5-year-old claims she's in charge, she gets corrected.
Yeah.
To our parents on the panel, I would love to hear your observations, whether in the classroom or with your own kids, sort of how you've seen this work and what that learning looks like for a 2-year-old, a 3-year-old.
Yeah, I agree with her as well, because communication is a very big cue for infants and toddlers, because when they come to us, they don't know how to communicate. So we have to learn, and we're teaching them how to communicate, even if they're just cooing, awing, that's communicating, and we're talking back to them. So they're knowing that there's a response with that. So, they're just building very good communication and language skills, I think, is very important for us.
Thank you.
Yeah, I also think that as a parent, giving your child the opportunity to expand on their vocabulary outside of the home, you'd be surprised what our children kind of learn from each other in the childcare setting. And also, I feel like it gives the parents access to early comprehension services. So it's hard when I have 5 children, so there's no way I can pinpoint, okay, this 2-year-old is having tantrums and I need to work on this, or my 11-year-old is having some behavior challenges. Getting them into school right in an early childhood setting early does give that room for comprehension services and helping with the wraparound services for the families.
It helps with self-regulation, too.
Yeah.
So it helps
Yeah.
them to regulate their emotions at an early age.
That is such an important point in thinking about having other adults that frankly know more than we do as parents. And I'm not a trained educator like you are, like many on this panel are, but I still know that I am not as good at identifying something in my own kids as I would be being able to be sort of a caring but outside adult, right, who is trained to recognize these things. And during the pandemic, again, sort of bringing back this important time that we're having this discussion, fewer kids were given that opportunity to have those other outside adults in these care settings. And so I really think we are working at a deficit to make sure that we get kids back into classrooms. And this applies, frankly, outside the early childhood education setting, too. But the pandemic was a period that has stressed our childcare centers, but also households and businesses and institutions. So I think probably Principal Johnson, you'd be the best to speak to this. Can you talk a little bit about what the pandemic has meant for the provider community from your perspective as a provider and for the kids? And we can allot 45 minutes for this answer.
Wasn't my favorite year. I see we have some parents in the LC. I remember you coming in and being like, "Are you guys closing?" I was like, I can't imagine we'll close, because we never do, right? Early childhood never closes. So, like, that, Elsie, is one of my things that I'll always remember about the pandemic, is parents were like, what are we gonna do? It was, the 12th, March. And things started just snowballing. So really quickly then, right, if we went back to March 2020, it became all of us watching the governor. And every day, when's daycare gonna open? When's daycare gonna open? When's daycare gonna open? And it shifted my field and my career from early childhood education to the work of getting, so other people could get back to work. Some of the research, everything we know about brain development quickly shifted to this, like, other people have to get back to work. And I think we still need to really hammer home the data that this is showing, that this is really hard work. It's very important work. It's a work that gets a huge return on investment. That if we invest now in early childhood, and all of the science that we know about it, we're going to save ourselves money, time, and family hardship in the repair work we do in middle school and high school and beyond. And that when families wonder, should I have my child? We saw 50% of families are like, I don't need my child in that. We need to shift that, of course you do, because look at all the benefits for it. Not that it is just so you can work. Maybe that's not your family. Maybe that's not something that you need during the day, but because of the benefits it has for your child and the very skilled educators and the people who work in this field that can help to support you as a parent, that can build your community of parents. So hopefully getting our field back to early childhood education. And you can't educate any child without caring for them. That's elementary school, that's middle school, high school, and college. We see that now too, all of the mental health and resources that we have. So just because they're younger doesn't mean that there's a fundamental difference in the care or the education that they're receiving.
Absolutely, thank you. Now this question is for any or all of you to jump in on. The study shared that a central piece of how parents evaluate the quality of an ECE provider relates to teachers, right? Just as most research would encourage. That's a marker for parents. Yet Ohio childcare teachers make an average of $10.67 an hour. So it's no surprise that coupled with the pandemic, the childcare and early learning community has a staffing crisis with those kinds of average wages. So how can the community and the public sector, government has a responsibility and a role here. What can we do to ensure ECE providers have high quality staff? And each of you has a perspective on this. If you just want to draw from your own experience, you don't have to think about what a city council member might do, or just think about your own experience, and if you could share what the community can do to ensure ECE providers have high quality staff. And I'll start with Dr. Ansari and then just work down the line if that's all right.
Sure. So that's just not acceptable. That's not an acceptable wage in 2021. We need to be investing in the workforce so that we get the best teachers, we get the most passionate teachers, because they, at the end of the day, make a difference in the lives of our youngest children. And right now, the deck is stacked against them. And so working for $10 an hour, juggling everything that folks have been doing, especially during this pandemic, it's not surprising that they're going to leave because we're not giving them the resources that they need to succeed and to support our youngest children. So from my perspective, it's critical that we continue to invest, we up the wages, and we give them the resources that they need so that they can care for our children, they can educate our youngest children in going forward.
Thank you. Ms. Cheeks?
For me, as a mother and an early Head Start prenatal educator, I think that to combat the crisis is that we need to work together with the families and the providers as a whole. We need to provide more opportunities for professional development for the providers, as well as accessing quality care within the communities, centers like SFC here. and also provide wraparound services for the staff and the families. There's entry-level labor positions that pay $15 an hour. Why are the people that are in control of our children's education and future, why are they being paid less? That's not a livable wage, not even in Columbus.
Yeah, and I just agree that I think the community and the early educators just have to continue to work together to reassure that we are providing the best care for our children, because this is an important field for everyone. So,
Thank you.
And I think, not only wages, but everything can't go on the back of our educators. You can't be, truly, they're small children, so you are also managing 20 children in a classroom. Are you also the speech therapist, helping mom get a job, helping a family get their heat turned back on, encounter the barriers that come through the door, because we foster those relationships, and then we say, we're going to give you some professional development in identifying autism, and now you're the autism expert. So not only investment in our educators, but the resources, as Jen was saying, Ms. Jennings, that will support that, so you're not stretched so thin, so you don't feel like you're working really hard and not doing a good job, that you have the backing of the community that comes in and supports our children and families.
Absolutely. And thank you for your insights on that, and to all the panelists. And there's just no logical reason that you're educating a 3-year-old and you're paid $10.67 an hour, and you're educating an 8-year-old and you're a salaried, depending on the district, right? Lot closer to respectable wage. So and part of this is making sure people understand what's happening before kids turn 5, what they need, the responsibility on educators. So I really think we can't talk enough about our educators. So thank you all so much for this conversation, for helping us illustrate the need for significantly more investment in early childhood education in our city. This is true in the short term, that we need more investment, and let's give actually a hand first to our panelists, because incredible insights that really do underscore how in the short term we need more investments. And on the city council, I'm advocating for millions of dollars to help prop up our struggling childcare centers and the staff who keep them running. We have an opportunity to do this with the federal government's investments through the American Rescue Plan, but this is not enough on its own. On Monday, I'll be sponsoring funding for another 1,000 slots approximately for our city's 4-year-olds to attend pre-K through Early Start Columbus. But that too is not enough, just as we've heard on this panel. We have this knowledge. We know the benefits of early childhood education, especially for our low-income families. What Dr. Ansari said at the beginning of his presentation, that 2-year difference between our least advantaged households and children and most advantaged children, is something that should keep all of us up at night. We have this knowledge now. We have to act to ensure there is a place for every child, a place that's safe and nurtures their growth, where they're cared for by teachers whose work is honored and dignified through their wages, and a place that their parents can afford and access near their home. So the Early Start Columbus program that has been in place since 2014, 85% of Early Start Columbus kids are ready for kindergarten when they get there. That is far above the average in our county, which is 40%. So that's really good for those children. But they have as many as 11,000 peers who might not fare so well because they don't get that edge in the classroom. For all of them, universal pre-K is the wisest investment we can make for their present and for our collective future. And especially in the time of COVID-19, our community has really opened its eyes to that promise of early learning and how absolutely essential the need is for quality care. And how essential it is to support all of us. I I'm really thankful to the Crane Center for gathering the voices of so many parents in our community. This research, if we just looked at data and we didn't talk to people, would mean a whole lot less. And to parents, access means quality, affordable, proximate, culturally competent options for early education and care. That will take eliminating childcare deserts, pushing the state to pay for the quality it is mandating in this sector in order to support higher pay for early childhood educators, and fighting, finally, for universal pre-K in our community. It's together that these changes will really help level the playing field for every family in Columbus. And as you heard from our panel, we have this knowledge, it's too important, and now is the time to act. So thank you again to the Crane Center team for partnering on this discussion today and on this study, specifically Dr. Laura Justice, Dr. Ansari, Janelle Williamson, and Jamie O'Leary. Thank you to the Crane Center team. I want to thank Mayor Ginther and the Future Ready Columbus CEO Jane Leach for their passion in early learning and their efforts to support our children in this city, the work they're doing to ensure that all kids are ready by 5. So with that, I will close and thank you very much.